Hey guys, welcome to my YouTube channel, and this is Franca's Health Corner, where we talk about everything health, beauty and lifestyle. So on today's topic on Franca's Health Corner, we'll be talking about kidney infection, specifically pyelonephritis. Why I'm discussing about pyelonephritis is because it's a common kidney infection that affects at least 100,000 people per year in Nigeria. What is pyelonephritis? Pyelonephritis is a specific kind of urinary tract infection that begins from the urethra or the bladder and travels all the way down to the kidneys. Now, what causes this pyelonephritis or this specific kidney infection? It is caused by a bacteria known as Escherichia coli, also known as E. coli. Now, we have so many bacteria which belongs to this class that can cause other kinds of kidney infections, such as cystitis, which is the inflammation of the bladder, or any infection along the urethra. How do you know you have pyelonephritis? One of the signs and symptoms you will get to experience that you have an infection to your kidneys is what? A flank pain, either at the back or at the side of your body. You get to experience a flank pain. Some people experience abdominal pain. In some people, they tend to experience fever. You have this strong urgency to want to urinate. You also experience painful urination, and in worst case scenario, you get to find blood in your urine or pus in your urine. You know, this kind of pus that comes out from your acne or infected wound. You get to see that kind of pus in your urine. Infection is more commonly in female than it is in male, because what? Females have shorter distance between the urethra and the bladder down to the kidneys. In female, this part colored green is the whole urinary tract. So you can see those two is the two kidneys, followed by the urethra and then the bladder. You can see inside here, this green one inside here is the bladder, right? So all the green ones are the kidney. So you can see for female, you can see where your whole private part is. So you can see for females, this is the kidneys down. This is your womb resting on the bladder. So you can see, right? So you can see this is the whole female private part. You can see how close to the bladder it is to this. So let's take a look at what the male one look like. This is the male one. You can see from here to the bladder, right? Can you see? It's it has to travel all the way down. That is why women have the highest chance of having this kidney infection. What do you do when you notice you have kidney infection? You might not necessarily know that you have kidney infection, but what do you do when you consistently have the back or side flank pain, because that's where your kidney is actually located, or you're experiencing painful urination, like anytime you want to urinate, you feel extreme pain, or you're seeing blood in your urine, or you're seeing pus in your urine, or you're always having the urge to urinate frequently. You must see all or some of these signs to conclude before concluding that you have any form of urinary tract infection. So if you get to see any of the signs or symptoms, it literally means you have a symptom of urinary tract infection. And the first thing to do really is for you to go to the nearest health facility where be properly examined by a doctor. Now, what are those things the doctor will do? First, the doctor will carry out some tests, such as what? Urine microscopy culture and sensitivity, where they will get to culture your urine. They also carry blood culture. In some cases, they will carry out various types of imaging studies depending on your physician at that time. However, pending when the result is out, the first line of treatment is what? The doctor will place you on some antibiotics, be it augmentin, resofin, for as long as 14 days or as long as 7 days, depending on the severity. It will now determine what route of administration. Are you going to take it by mouth, which is orally, or intravenously, which is injecting it through your vein? It is now left for your physician to decide. Another thing the doctor, will do is encourage you to take adequate fluid. Now, once you notice any form of infection, one of the best ways to get out, one of the best and natural ways to get out any form of infection on from your system is what? You take lots of water. Take adequate water, take lots of water, because what it will literally do is that it will help flush and cleanse your system, and then you get to pass it out. So naturally, you'll be encouraged to take a lot of waters, you'll be encouraged to have adequate rest while also taking your medication. And in some cases, some form of painkillers, which we call analgesics, will be prescribed for you to reduce what? The fever, to reduce the symptoms, to just generally make you feel well and okay. Another thing you can do while you are at home and getting enough rest and you are still in pain, you can use a warm towel, to apply on that, just use it to like massage, give your tummy like a little massage to just relax all those your nerve endings that are causing you pain. Now, why is this topic really important for you to know? It's because if urinary tract infection goes untreated over a long period of time, it can cause permanent or premature kidney damage to your kidney. It's actually a very life-threatening illness that needs to be handled or tackled immediately. You don't want to be faced with any form of kidney damage or kidney issues. Another complication of untreated urinary tract infection or pyelonephritis is that it can cause blood poisoning, which I'm using the layman's word, which literally means it can cause systemic infection. So E. coli infection, going round and round and round your system, and before you know it begins to house itself in parts of your body organ. Another thing, in pregnant women or in pregnancy, it can cause low birth weight. What do we mean by low birth weight? The baby's weight, you begin to have 1 point something, you have low birth weight because of what? Untreated or undiagnosed urinary tract infection. So whenever you have any signs or symptoms that has been mentioned, please do not hold it or hide it or privately want to treat it. Kindly go to the nearest facility or the nearest hospital, talk with your medical practitioners, and they will be able to help you and solve this problem. Till I come your way again next time, thank you for listening, thank you for watching, and this is Franca's Health Corner. We will talk about everything health, beauty, and lifestyle.